Good evening, everybody. Today I'll be talking about low informational literacy among anesthesia providers. So technology shapes almost everything we do in preoperative environment. We rely on smart pumps, mobile apps, and decision support tools every single day. But even though these tools are designed to enhance safety, many anesthesia providers still struggle with informational literacy. When it comes to standards and regulations, professional organizations are very clear about the need for informatics competency. The ASA requires providers to use electronic system safety because they are tied to monitoring and documentation. The ONC sets national expectations for accurate electric documentations and secure handling of patient information. Legal and ethical consideration. So, low informational literacy always also creates a legal and ethical concerns. If a provider documents incorrectly because they couldn't navigate the system properly, that could become a liability issue in court. Poor documentation is often treated the same as poor patient care, and the lack of digital skills does compromise patient care. There are several ways low informational literacy affects everyday anesthesia practice. First, it increases cognitive load. When a provider is focused on figuring out a screen or a system, that does take away from time focused on the patient. Second, programming errors become more likely when smart pumps and digital medication libraries aren't being used correctly or they're not being used at all. Third, decision support alerts may be misunderstood or ignored, leading to missed warnings. And finally, providers may struggle to locate critical information about patients when it comes to airway and medication, leading to leading on a negative impact on patient care as well as preparation. For CRNAs, informational literacy directly affects how we assess patients, plan anesthetic care, and communicate with handoff. When providers struggle with digital navigation, assessments may be incomplete or delayed. Workflow becomes less efficient, leading to delayed case starts and higher stress. Over time, these challenges contribute to burnout. On an organizational level, low digital competency affects quality metrics such as medication safety and documentation accuracy, as well as PACU readmissions. So research does show that there is a strong connection between informational literacy and patient safety. Studies show that providers with low informatics skills commit more documentation errors. They take longer to complete electronic tasks, as well as this slows down workflow, especially during critical moments. Smart pumps shows that informatics training can cut programming errors nearly in half, and hospitals that implement structured informatics training report better documentation accuracy and fewer complications. Low informational literacy affects patients both directly and indirectly. Poor documentation leads to miscommunication. Medication errors often become more likely. When providers can't quickly interpret electronic data, complications may be recognized later than they should. And in contrast, when providers are digitally competent, they respond faster, they make more accurate decisions, and maintain clear records, which all improve post-operative outcomes. To address these issues, I've listed some recommendations, which include provide constructed real-time feedback, promote interpersonal training, as well as doing annual competency assessments, and simplifying workflows to reduce cognitive burnout. So, in conclusion, low informational literacy has significant impact on anesthesia practice. It affects workflow, decision making, and ultimately patient safety. As preoperative environments become more and more digital, strong informatics skills are essential for CRNAs through education, simulations, and ongoing competency assessment. Anesthesia providers can strengthen their digital literacy and provide safer, more efficient care. Ultimately, improving informational literacy is about improving outcomes for patients we serve. And these are my references. That's it.